Assalamualaikum and hi everyone. Today we are going to present about schizophrenia. So what is schizophrenia? Schizophrenia is a chronic and severe mental disorder that makes it difficult to distinguish what is real, what is unreal, to manage our emotions and to be able to function normally. This is a long-time disease. It cannot be cured, but it can be controlled with proper treatments. So how do we diagnose schizophrenia? If symptoms of schizophrenia occurs or present, the doctor will perform various tests. For instance, physical tests, blood tests, brain imaging studies, and complete medical history. So, what are the symptoms of schizophrenia? A person diagnosed with schizophrenia must have at least 2 of these symptoms for 6 months straight at least. So, the first symptom is delusions, hallucinations, disorganized speech, disorganized behavior, and negative symptoms. So, how do we know the warning signs of schizophrenia? The warning signs of schizophrenia includes depression or social withdrawal, extreme reaction to criticism, neglect of personal hygiene, expressionless gaze, inability to express joy or sadness, or inappropriate laughter or crying. They start to oversleep and or insomnia, which makes them becoming forgetful or unable to concentrate. Last but not least, odd or irrational statements. They use strange words or way of speaking. That's all. I will pass to the next presenter.
Hi, my name is Nuranis Najwa binti ZAILANI and my metric number is 2200702. Schizophrenia requires lifelong treatment even when symptoms have subsided. How is schizophrenia treated? The goal of schizophrenia treatment is to ease the symptoms and to cut the chances of a relapse or return of symptoms. Treatment for schizophrenia may include medications, psychosocial therapy, hospitalization, and electroconvulsive therapy, which is ECT. Firstly is medications. The primary medications used to treat schizophrenia are called antipsychotics. These drugs don't cure schizophrenia but help to relieve the most troubling symptoms, including delusions, hallucinations, and thinking problems. There are 2 types of antipsychotics, which is first generation and second generation. If someone who is resistant to take medication consistently, he or she may need it to be given injections instead of taking a pill. Secondly, psychosocial therapy. While medication may help relieve symptoms of schizophrenia, various psychosocial treatments can help with the behavioral, psychological, social, and occupational problems that go with the illness. Through therapy, patients also can learn to manage their symptoms, identify early warning signs of relapse, and come up with a relapse prevention plan. Psychosocial therapies include rehabilitation, cognitive remediation, individual psychotherapy, family and group therapy. Thirdly is hospitalization. Hospitalization may be the best option for people who with severe symptoms, who might harm themselves or others, and who can't take care of themselves at home. Lastly is electroconvulsive therapy, which is known as ECT. It's a procedure done under general anesthesia in which small electric currents are passed through the brain, intentionally triggering a brief seizure. ECT seems to cause changes in brain chemistry that can quickly reverse symptoms of certain mental health conditions. Psychology skills that is best for schizophrenia is cognitive behavioral therapy, also known as CBT, may be a treatment option for people with schizophrenia. CBT teaches a person to modify beliefs or behaviors that may be leading to negative emotions. The therapy has 2 main parts: a cognitive component, which helps a person to change his or her thinking about a situation, and a behavioral component, which helps a person to change his or her reactions. Cognitive behavioral therapy is a short-term, problem-focused approach with the goal of teaching people who have schizophrenia a variety of coping skills to help them manage difficult situations. This type of therapy is typically given for 1 hour a week during the course of 12 to 16 weeks. Cognitive behavioral therapy can also help people with schizophrenia to develop better social and problem-solving skills, reduce the severity of symptoms, and lower the risk of relapse, a period of time when schizophrenia symptoms return.
Assalamualaikum warahmatullahi wabarakatuh, and hello everyone. My name is HAFIZAH binti BAHARIM. My matrix number is 2200699. So now I'm going to continue a little bit more about how best to support someone who is living with schizophrenia. Firstly, the first thing to start is educate yourself. The person who closest to the patient must educate themselves about the disease so that they are easy to deal with the patient. It is usually a close family member. They need to be given exposure and knowledge related to the disease, such as relapse symptoms, treatment, and ways to cope with the relapsed patients. Caregivers also need to understand the patient's emotional changes by identifying the symptoms shown such as depression, aggressive behavior, and deal with the situation wisely, so that it does not become a threat to the caregivers and family members. Another support is to stay in touch. It is because a good communication is really key in terms of supporting someone with schizophrenia. So you may talk with them openly about the diagnosis and about any struggles that may be dealing with, and to not let it just sweep under the rug. For example, always text on your friends or beloved one about what is going on. Last but not least, the person must be really patient, or we call it the caregiver. Some patients with chronic schizophrenia are difficult to control and require intensive treatment and care. That patient lies not only in the willingness to care for the patient, but also include the physically, mentally, and financially of the caregiver. Therefore, the caregiver must be patient by giving full love and encouragement to the patient. Even the level of care varies according to the patient's level. That's all from me. I hope with the tips can be used by the caregivers or the person who want to take care of the patient, to support them to fight their schizophrenia.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. My name is ADLINA binti AMIRUDDIN. My matric number is 2200713. I would like to share with you on how to take care of this mental illness. So this mental illness is called schizophrenia. Okay, one thing and very important thing you need to know is taking care of yourself is not selfish. In fact, it's just as important for your loved one with schizophrenia that you look after for your own health. So schizophrenia can place incredible amount of stress of the family. Means that if you stress, the one that have a schizophrenia can feel stressful and trigger with your act. Okay, on how to take care of this mental illness. First, you can connect with others. Mean that you need to have a social interaction with someone who care about you. Is the most effective way to release your stress. It's important for both of you and the person who has a schizophrenia having a conversation face to face. You can find someone that you can talk for an uninterrupted period of time. We can have our friends, we can have our family, we also have our therapists who connect. They will not charging us if they listen to our problems. Second, you can get a regular exercise. Meaning that physical activities can reduce stress and release your endorphin. a powerful chemical in your brain that energizes your spirit, can make you feel good. Whether you exercise alone or you have with your friend or with your loved one. Estimated time is 30 minutes for physical activity. Third way is we can eat a healthy diet. Means what you eat has an impact for your health and for how you feel on that day. Fourth way that you can use is you need to practice acceptance. Practice acceptance means that you accept every feeling that you feel, even the negative one lah in your life. Because it can make a huge difference in your ability to manage your stress. In that, if you can accept your negative one and change it to a positive one, it can reduce your stress on that day and balance your moods too. Okay, the last one is you seek out for your joy. It means that you're making time for fun. You find something that you can do that make you feel joy on that day. For example, you can spending your time in nature, you can visiting your friend, you can reading a book. So maybe we can call this joy as a hobby that you really like to do. That's it that you can use to take care of this mental illness.